You're listening to GCN, the Genesis Communications Radio Network.
Welcome back to the NutriMedical Report. Yes, by overcoming these enzyme defect polymorphisms, literally you switch off what I call the famine reflex. The famine reflex is where a nutrient's not present. The body says, oh my gosh, that nutrient's not present, so it shuts down the factory. So you don't burn off calories, you store, you raise blood insulin levels, you have increased tissue, and then the side effects are inflammation, vascular conversion to make excessive levels of lipids, all the other nasties that were called Syndrome X. So you found a way of solving that, which is very elegant. It deals with nutrients and dealing with the polymorphisms. And we talked before about a Korean and other scientists have actually done gene tests, and we're looking to see if we can get in touch with them. Do you remember that name of that scientist, Dr. Phil?
You told me to look that up and get it for you, and all I can remember that it had a name like Good Gene Doctor or something like that.
Yeah, I pulled up a bunch of references on it actually, and from Korea and elsewhere, looking at adiponectin and other genes. And
right.
What's neat about this is that you could actually do a scraping of someone's mouth and find out which genes. That would then tell you exactly which nutrients they're going to particularly need a high amount of to switch off what I call the famine reflex. And if I was to co-write a book with you, which I've been working, because I did some of the original research on Syndrome X years
right.
before Dr. Ravens on diabetes, between 1980 and 84 with Dr. Autoimmune, a pathologist at the University of Calgary. And what we discovered was an insulin glucose tolerance test. Insulin levels were massively elevated. I saw insulins 50 times higher than normal in diabetics and pre-diabetics, 5, 10, 20 times. And these levels are elevated because the tissues are resistant, but it's part of the response of an organism, the body, to deficiencies in things like vitamin B6 that's activated because the activation enzymes have a DNA polymorphisms, vitamin D,
right.
a whole series of them, vitamin K, many others. And when they're present, when these things are not present, the body literally switches off and says, that's it, shutting the factory down. And then the person gets fat, or they develop all these other symptoms. Even if they don't get fat, they have Syndrome X with central weight gain. Mm-hmm. Tell us how you solved this. Go step by step.
Well, it took a time. I realized that many of the products that I was finding deficient in these people, the enzyme that was responsible for making that product utilized B6. So I started looking at these people and found that a lot of them who took vitamins had very high vitamins. Oftentimes if a B6 was supposed to be 32, they would have greater than 300 or greater than 100 or whatever the lab would test. And the interesting, I knew about the Mickey Ellis-Menten constant, which demonstrated that in a mutational situation that you had to increase, the mitochondria, the actual cofactors multiple times, or things didn't work. And they did this with autistic kids, of course, over in Europe. And Vogelaar was a really sharp old fellow who did a lot of that work. And he showed that, for instance, in I think it was vitamin B1, you had to have 3 to 250 times more in these kids, and the autistic kids have a similar gene to the metabolic syndrome, except they have a couple of other deficiencies that make them unique. But
that's why we use allithiamine, developed by the Japanese after the Second World War with the beriberi syndrome. And interestingly, the problem with sudden infant death syndrome disappeared when they went back to the old unrefined rice because it had the fat-soluble vitamin B1 on it. When it wasn't present, the drive center for respiration literally shut down. These kids stopped breathing, and they got sudden infant death. And so this is one of the gene polymorphisms, conversion and activation of B1 that's present in people that tend to gain weight.
Right, and then the other major one, almost every single one of them will have a B6, and then they'll sometimes have B2 as a problem, some of them will have B1 as a problem, additional. But almost the centerpiece in all of them is the B6. And if you look, B6 is responsible for making D, for instance. It's responsible for making serotonin. It's responsible for breaking down serotonin. So when you see these kids are in jail, they've got real high serotonin levels. I've gone into jail, and I've given these kids activated vitamins, And at least one of them, one special patient that I worked with a really long time, I gave him these activated vitamins, monitored him. His serotonin dropped down from like 400 and something down to 100 and something, and all at once he became a nice kid and wasn't fighting all the time, and he wasn't reacting all the time, and he was, every time you said something to him, he didn't get angry, and he got out of jail early. He was due to stay in there 4 years, and I think we got him out in about a year and a half, but it took about a year and a half for him to get better because he wouldn't do things at first, and you had to work with him, had to go visit him a lot to get him to do what I wanted him to do, and then I had to work with the jail to get him to do what I wanted him to do. But anyway, the point is that was an example of the polymorphisms affecting people, but most of the polymorphisms that we look at, they affect a lot of things. And for instance, one fellow I was telling you about that was brown and bronze. He looked like he was, in the wintertime, he's kind of light complected. At the end of the summer, he's really brown, and he has a vitamin D that's unbelievably low. It's almost so low you can't find it, down around 7 when you want it around 80. And here he was out in the sun all summer. Well, he couldn't make it because he wasn't taking any activated B6, and he needed B6, and his belly got bigger that summer, and he just went to pot, as they used to say in the old days, because one of the signs that B6 isn't working is when you get abdominal obesity. And another sign of it is when you get autoimmune diseases. So I got all these people that come in with everything from sarcoidosis to ulcerative colitis to psoriasis, and they all have part of the genes of the metabolic syndrome, but they may not have all of them. And so there's a family there like a rainbow, and on this end of the rainbow you get these diseases, and on that end of the rainbow you get the other end, in the middle you get them all, basically.
Yeah, this is a big thing, though, because what you've got here is, I call it the metabolic motherlode of most degenerative diseases, is the one or more of these polymorphisms as a group that causes syndrome X: central body weight gain, abdominal obesity, diabetes, vascular disease, cancer, macular degeneration, kidney failure, polyneuropathy, amputated limbs, immune system suppression with weird infections. It all goes as one big group, all tied in with these same things.
Yeah, and the interesting part about it is all these drug companies have gotten rich fixing, say, parts of it.
Right. Or the surgeons, where they advertise there in Southern California here, where they advertise, Scripps Hospital with a banding procedure. I call it the Hal Roker syndrome. If you don't fix the metabolism, if you don't give them the activated B6 and the vitamin D and whatever they need, you're not going to fix the problem, and eventually their weight's going to go back up. And in fact, in many cases, because you've also not protected them as their fat is being mobilized because they're going to dump toxins, they often have, at the end of 2 or 3 or 5 years, they develop cancer, heart disease, dementia, or many other problems that you wouldn't have anticipated, and their weight goes right back up.
Right. Now, there's a group around here that does it, and they require 40, 50-pound weight loss before they'll ever operate on them. And it turns out that, for instance, corn syrup in these people, not in everybody, but in these people, it causes their ghrelin to go up, which stimulates their appetite, and it makes them grow bigger. And they also get chronic inflammation as a result of the corn, and the corn also causes the beta cells to be immobilized and eventually to die. So when these people come in and they tell them to lose weight, and some of them come to me and say, well, I want to get my stomach banded, but I want to lose weight. And I say, well, it's really simple, lose weight. I mean, you get off all the corn products, and that'll help you alone. But if you take these simple activated vitamins, you'll really lose weight. I could drop somebody 40 pounds in 3 months with no problem.
Yeah, that's amazing. And, this is the cause. If you're trying to wonder why you can't get your New Year's resolution to lose weight, and if you do lose weight, even by starving, exercising, you regain it. It's metabolism, and we're dealing with it today with Dr. Martin. We'll be right back.